So, do dogs need vaccinating every year? Now, that's been something that the vet community's been arguing about for quite a while, and I think the answer to that really is it depends on the dog's individual circumstances. So, our policy is that basically adult dogs only need parvovirus, and hepatitis vaccines every 3 years, and there's a lot of evidence to support that. Now, there are some people that argue that dogs should still be vaccinated annually, and the reality is that vaccines are very, very safe. But we do very, very occasionally see a reaction to a vaccine, and my argument is that if we know the vaccines are lasting for 3 years, why would we want to be giving a vaccine? Even that small risk, I think, is a risk that we don't really want to be taking. So our recommendation for vaccination schedules, we recommend giving the first puppy vaccination at around 6 to 8 weeks of age, so that really should be done with the breeder. Second vaccination at around 10 to 12 weeks of age, and then a final vaccination at 14 to 16 weeks of age. That's the puppy course. Then at 15 months of age, so 12 months after we give that last puppy vaccination, we give another vaccine, and then every 3 years after that, they have the parvovirus, and hepatitis. Now, kennel cough, that's a bit of a different situation. Now, every dog should be vaccinated against parvovirus, and hepatitis because the viruses can be carried on shoes, on clothing, and dogs that never even leave the backyard can still pick up these infections. Whereas kennel cough tends to be more of an aerosol infection, and the main type of kennel cough that we see is actually closely related to whooping cough. So it can be a pretty nasty sort of thing, which means that we do really want to be vaccinating dogs that need the protection, but dogs that don't need the protection, so dogs that are on farms that never see other dogs, it's really something that we don't want to be giving unnecessarily. So kennel cough, we know it needs to be given annually because the vaccine doesn't last very long, and the reality is that over that 12 months in between vaccinations, it actually becomes less effective. So some people argue that it should be done every 6 months. We think at the moment every 12 months is about right to get the compromise between efficacy and vaccine safety. So kennel cough, we normally give that first dose at around 10 to 12 weeks of age when the dogs are going to be starting to get socialised, and then 15 months of age is the next one. We tend to use an oral or an intranasal vaccine, so that way single doses are very, very effective, and we keep on doing that annually while it's indicated for the dog. Now, even if your dog's not getting a vaccination each year, it's really, really important that they have their annual health check each year. So even without the vaccine, you still need to be getting your dog into the vet just to make sure that there's no problems that are brewing. And we can quite often pick up things at a very early stage that it can make the difference between successful treatment and the dog either suffering with them for a long time, or even in the worst case scenario, the dog passing away from it. So yeah, worth coming in every year, but the vaccine, really have a good chat with your vet. There is the occasional case where we want to be given the parvovirus, and hepatitis more frequently, so such as if the dog is exposed to parvovirus either through a friend's dog or kind of a puppy that develops parvovirus infection. But that's really about the only time that, like I say, if you have any concerns, certainly chat with your vet, ask them why they choose that particular vaccination schedule, and they should be more than happy to talk it through with you.